Hi, you guys. Welcome back for our daily practice questions. It is day 136, and it is day 6 of our Pharm series. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. And don't forget to hit the subscribe button so you don't miss any notifications for my upcoming videos. Question number 1 states, what is the first-line treatment approach for a healthy adolescent diagnosed with mononucleosis? Is it A, high-dose amoxicillin for 10 days? Is it B, supportive care with rest, fluids, and antipyretics? Is it C, oral corticosteroids for all patients? Or is it D, antiviral therapy with acyclovir? Take a moment and tell me what you got. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem is the question is the stem, right? And it states, what is the first line treatment approach for a healthy adolescent diagnosed with mononucleosis? All right, so what is first line treatment for mono? Your best answer is B, right? We do supportive management, supportive care, symptomatic management for mono. Mono is a viral illness, right? From the Epstein-Barr virus. So we don't need the high dose amoxicillin. You need to give supportive care. You want them to rest. You want them to stay hydrated, right? Supportive care, symptomatic management. All right, question number 2. Which medication should be avoided in patients with mononucleosis due to the risk of rash development? Is it A, acetaminophen? Is it B, ibuprofen? Is it C, amoxicillin? Or is it D, diphenhydramine? Take a moment and tell me what you got. All right, all right, all right. So again, stem is the question is the stem. Which medication should be avoided in patients with mononucleosis due to the risk of rash development? And your best answer is C, amoxicillin. We try to steer clear of amoxicillin in patients who have mononucleosis. That Epstein-Barr virus component, it leads to a maculopapular rash, okay? So to avoid that, we avoid the amoxicillin, okay? And then lastly, question number 3, when advising a patient with infectious mononucleosis, what is the most important reason to avoid contact sports for at least 3 to 4 weeks? Is it A, fatigue? Is it B, fever? Is it C, risk of splenic rupture? Or is it D, for transmission to others? Take a moment and tell me what you got. All right, so STEM is the question is a STEM, and it states, when advising a patient with infectious mono, what is the most important reason to avoid contact sports for at least 3 to 4 weeks? And it's C, because you want to avoid the risk of splenic rupture. They may have splenomegaly, so contact sports can cause the spleen to rupture. All right, you guys, I just want to throw that in because it's an additional treatment for mono. And along with the symptomatic management, we always tell them to refrain from contact sports from 3 to 4 weeks, right? So I just wanted to make sure you understood the reasoning. So if you run into questions like this, or if you run into this scenario in practice, you know the why behind it. But as always, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number, or shoot us an email to thenursingstudio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.